The Rural Iowa Telehealth Initiative was a collaborative effort between UnityPoint Health Des Moines and 4 of its rural affiliate network hospitals to really provide the information to complete the BTOP grant. The goal of that application and the grant has been to provide broadband capabilities to the medical facilities in the rural and underserved areas of Iowa, to provide access to a number of specialists in those communities so the patient can remain in the community for their care, to provide training and education for healthcare practitioners in those areas, and to facilitate telehealth. Through face-to-face communication, not only in the clinical setting, but for video conferences and video calls and training and education, it has so connected these rural communities to our facility here and facilities throughout the state to provide education, training, and clinical application. The medical facilities that we're connected with through the grant and the rural hospitals have really taken different paths with their telemedicine program and their video communication equipment.
Greene County Medical Center is using the video telehealth system for medical care, but we also wanted to create a system of connecting all of our community partners to plan and prepare for response to disasters. The hospital and public health as one organization have been able to deploy video conferencing equipment to our community partners. This has allowed them to have a level of technology that they didn't have before. Using the video conferencing allows us to get together frequently for very short meetings to make sure that we're all staying on task and providing a very unified response to the disaster. By planning, training, and preparing together and using it for drills together, it will make sure that our community and our county is very well prepared so that we can give our citizens the best response every time.
Clark County Hospital is using telemedicine in several ways, most predominantly in our outpatient clinic. Patients have shared with us that they simply avoid their specialist appointment because they don't have the resources to get there. We've been able to provide outpatient services. Patients are only missing maybe an hour of work, not having to drive, not having to ask a relative to bring them to an appointment.
I personally benefit from access to telemedicine by not taking time off work. I can just run in and have my appointment, and then I leave and go back to work. It's easy, it's fast, it's quick.
We have telemedicine capabilities on our med-surg unit. This means that our inpatients have access to specialty consultations right there in their very own room. Prior to telemedicine, if a patient needed a specialty consult, they would be transferred. So we're saving transfers and hearing from family members and patients that they're very pleased to be able to remain right here in the community.
We use technology for education in several different ways. Currently, we have 8 different school systems that are involved in this effort and 9 EMS crews that are also involved. I think it's important to provide health education to students of all ages because down from kindergartners, you need to know how to take care of yourself. We feel here at the hospital that knowledge is prevention. Video conferencing is offering things to our students that they wouldn't normally have in the past, such as being able to have a virtual field trip to Grundy County Memorial Hospital when they wouldn't have been able to come inside these walls otherwise. We have a bunch of different educational opportunities here at the hospital, and this provides us a way to get out to the community without having to travel long distances. It's wonderful that we can reach schools that are about 45 minutes away without having to drive and spend the time to drive. The goals for education for us at the hospital is to increase awareness that this technology is out there, and also to get people to use the technology and become more comfortable with it.
The telemedicine initiative and really the video equipment and the connectivity that we've been able to provide through the grant has really taken on a lot of different versatile uses within the communities. Our goal is to really be the telehealth, video conference, and telemedicine leaders in the state. And I think through our healthcare system, we will be able to do that.